Hello students, today we will discuss about another endocrine gland, that is the thyroid gland. The thyroid gland is the largest endocrine gland which is located in the front of the larynx and upper part of the trachea. The thyroid consists of two connected lobes, the right lobe and the left lobe, on the either side of the trachea. The lower two-thirds of the lobes are connected by a thin connective tissue known as isthmus. The thyroid gland is made up of follicle cells which are held together by connective tissues called stroma. The stroma contains blood capillaries and small group of parafollicular cells, also known as C cells. The thyroid follicles are composed of a wall of cuboidal epithelium resting on a basement membrane and is filled with a gelatinous colloid. The thyroid gland secretes three hormones: thyroxine, triiodothyronine, and calcitonin. Thyroxine in its structure possesses 4 atoms of iodine, whereas triiodothyronine possesses 3 atoms of iodine. T3 and T4 are secreted by the follicle cells, whereas C cells or parafollicular cells are secretes calcitonin. Thyroxine contains 4 atoms of iodine and triiodothyronine possesses 3 atoms of iodine. But T3 is more active and several times more potent than T4. But T4 is secreted more in amount than T3. Hence, T3 amount is increased by the conversion of T4 to T3 with the loss of one atom, iodine atom. T4 and T3 have virtually identical effects on the target cells. Hence, they together are considered as thyroid hormone. The functions of thyroid hormone are: maintain the basal metabolic rate of the body. You can say the whole metabolic activity of the body is controlled by the thyroid hormone. They regulate protein synthesis and promote the growth of the body tissues. They maintain normal body temperature by increasing the heat production. They regulate the development of mental faculties. They help in the metamorphosis of tadpole in an adult frog. They increase some actions of neurotransmitters. Excess secretion of thyroid hormone or deficiency of thyroid hormone can cause disorders. Excess secretion of thyroid hormone or hypersecretion of thyroid hormone causes hyperthyroidism. It results in increased basal metabolic rate, increased sensitivity, sweating, flushing, rapid respiration, palpitation, increased gastrointestinal activity, also increased cardiac output. The name of the disease is Graves' disease or exophthalmic goiter. One of the characteristics of this disorder is the protrusion of eyeball. If you see the eye of the person, it seems that the eyeball will pop out from the socket. Deficiency of thyroid hormone causes cretinism, myxedema, and simple goiter. When deficiency of thyroid hormone occurs in infant, it leads to dwarfism. The patients are mentally retarded. They possess dry skin, thick tongue, prolonged neonatal jaundice, lethargy, respiratory problems, and constipation. Although this can be treated with early administration of thyroid hormone. Here, we can see that deficiency of growth hormone also causes dwarfism, but there is a difference between the dwarfism, which is caused due to deficiency of growth hormone, and deficiency of thyroid hormone. When deficiency of growth hormone causes dwarfism, but the patient will not be mentally retarded, but here in case of cretinism, the patient is mentally retarded. Next, myxedema. Hyposecretion or deficiency of thyroid hormone in adult causes myxedema, which is characterized by peculiar thickening and puffiness of the skin and subcutaneous tissue, particularly of the face and extremities, due to low metabolic rate and retarded oxidation. The patient lacks alertness, intelligence, and initiative. The patient suffers from slow heartbeat, lower blood pressure, low body temperature, and retarded sexual development. This can also be treated by the administration of thyroid hormones. Next, simple goiter. This is caused due to the deficiency of iodine in the diet. Iodine is required for the synthesis of T3 and T4, as we have seen and studied earlier. It is characterized by enlargement of thyroid gland. It may lead to myxedema. This disease is commonly seen in hilly areas. Addition of iodines to the table salt can prevent this disease. You can see here, due to the deficiency of iodine, simple goiter has occurred. That is, the thyroid gland is swelled. Swelling of thyroid gland has taken place. It is secreted, calcitonin, it is secreted by the C cells of thyroid gland. It regulates the concentration of calcium and phosphorus in the blood. It prevents the loss of calcium from the bones, hence control the concentration of calcium in the blood. Thank you.